Hi, and thank you for joining me on the latest Ford's Hospital Workforce Chats, where I speak with inspirational leaders who are making a difference to the teams of people working in healthcare and changing the way we think about workforce development in our hospitals. Today, I'm joined by Amanda Clark, the Executive Director of Nursing Workforce and Patient Experience from Central Adelaide Local Health Network, to talk about nurse attraction initiatives, incentive planning, and because I know Amanda has an interest and passion in building sustainable and efficient healthcare systems to promote better patient care outcomes and improve staff safety. Thanks for joining me for this workforce chat today, Amanda. How's your week looking and what are you working on at the moment?
Hi, Anthol. Thanks for having me. Yeah, work's looking very busy. Pretty standard week in Central Adelaide Local Health Network, and probably, if not for any EDON across this country. But yeah, it's looking good. Thank you for asking.
Yeah, perfect. It's a busy space, isn't it, at the moment? There's a lot of pressures and a lot of demands being placed on lots of leaders across the healthcare system. So, I totally emphasize and get that the weeks can get away.
Absolutely. One thing rolls into the other.
Yeah, for sure. I guess the first question I had for you is, I think our listeners will be really keen to hear how you prioritize and plan and structure your work week. Is that pre-advance planning or is that in the moment? How does that sort of work? I suppose when things pop up all the time.
Yeah, okay. Well, look, my diary is always as planned in advance as it can be. But in a lot of situations, my diary day runs in back-to-back meetings consistently, without breaks or any opportunity for, accidental run-ins to colleagues in the corridor, which is often some of the best ways to get a really quick outcome and achieve a goal. So generally speaking, I do have an EA who supports me in this. We've got all the pre-booked normal cadence meetings in there, and then on top of that, normally every day I'm having a look at things and then cancelling or adding as the day goes on. And probably most days I would say I probably flick at least 1 to 3 meetings that are either a double or a duplicate for me, to another staffing member who can help support and lead that team through that meeting. But yeah, so it's just it's a juggle. You've got to prioritize the patient and the staff as a number one. My nursing directors, who are my direct line reports, are well aware that if they need to be in touch with me, they need to be very clear about that with my EA so that she knows she needs to then rejuggle my diary.
Yeah, absolutely, and help prioritize, the most important elements as well. And I guess, is there do you emphasize any communication techniques, or it's just really get the point across first and then we'll see what we can do?
I think everybody communicates really differently. I like things to be short, sharp, and simple. It doesn't matter whether that's in writing or in a normal, a verbal discourse. My advice for most people would be is to always follow some sort of framework, some sort of communication framework. It's not outside of the boundaries of nursing anyway. Most places are used to some sort of escalation communication framework, whether it's SBAR or SBAR when you're trying to get an outcome for a patient. And I would say just adopt what you know and apply it to different situations so that you are quick, short, sharp, and simple, because sometimes the messaging gets lost in the big words and the big paragraphs and the long sentences that you just don't really need to get your job done.
I totally agree. And actually, I was talking to my cousins who are just going through nursing at the moment and talking through that that framework, and especially just around those communication techniques. And you are right. Whatever you're comfortable using is really important, but it is about, distilling that big picture information into, what are you trying to talk about? Because I think sometimes in nursing, we get lost in the details a little bit, because that is also one of our big power plays, is because we're so detail orientated sometimes, is that we don't miss things. We pick up things, we advocate on the small stuff that can turn into bigger stuff. But if we apply that to everything and we don't think about the bigger picture, it can all get lost in the washing machine.
Absolutely, absolutely. And you've got to target your message for the right audience. At an executive level, it's really important for us to talk about the finances and how everything impacts on the finances, because ultimately that affects how we get our national elective surgery targets down, our national elective access targets down, because money matters. We're a business. But you wouldn't have that conversation downstream to your nurses that aren't trained in finance and can't draw the link yet, because they're not trained to do that yet at that level. So it's really important to draw out what that means for wellness and what those metrics mean in the wellness space in terms of FTE, and what you're looking at when you're talking about cultural change, which therefore also will affect how you get changes done and complete, and how you impact on the NEAT targets, the NEST targets, and all those actual operational metrics that we need to keep a business like health and hospitals running. So I think you need to be really careful about targeting that message and remembering who your audience is.
It's absolutely pivotal to anything you're doing, is that you're actually sharing a message that resonates with the people that you're talking to. You're totally right. And so planning is so important for our current nursing workforce challenges, and especially in our nurse attraction retention is on every leader's agenda. Where does nurse attraction fit in your priority list?
It's high. Attraction is always high. We know that we're coming into a 90,000 headcount deficit across Australia within the next few years, but the deficit exists worldwide, and we've been coming towards this pre-COVID as well. So attraction is high, retention is higher. For me, I think we've got to make sure that we don't lose the staff that we've already got, and we've got to demonstrate value to those staff we've got. But in terms of attraction, the things that we really need to be doing is understanding what makes an organisation attractive to work for. And that's not necessarily conducive to just health organisations. We can look outside the box for what other areas are doing and then massage it to fit. I think what we're seeing in a lot of research now is that actually what nurses really want, and a pay rise is great, awesome, nobody's going to turn that down, but what they really want is to be able to do their job. What they really want is to be able to be a family member and do their job. So they're asking for flexibility, they're screaming for agility from the organisation, and they want scope of practice to be optimal. They want to feel like they've done a good job. They want to value their job and have job satisfaction when they're here, when they're away from their families. And then on top of that, a little bit of pay doesn't go astray. So I think we've really got to start looking at the models of our workforce and our rostering. I think that obviously we need to roster to the activity and acuity across the organisation, across a 24/7 pendulum, but we also need to understand our peaks and troughs in terms of what staff want. Is it necessary for staff to do a 12-hour shift? Is it necessary for them to do an 8-hour shift? What's happening with your sick leave? Are people taking a sick leave day because they've got a GP appointment at 10 o'clock? But it's too hard to ask to come in late because they can't backfill that shift and they're a clinician on the floor. Now, ultimately, as a previous nurse manager, I understand that that is really challenging and difficult to do. But the fact of the matter is, if they take PCL for 4 hours and we only backfill at premium labour for 4 hours, it's still cheaper than backfilling it for 8 because they didn't feel like they could ask for the day. And that's similar, not too dissimilar from people that might have concerts on for kids, or they've got elderly parents to care for. So I think we need to understand what our workforce is doing and what they're wanting. We need to understand the next generation as well. Gen Z just don't want to do it this way. They don't want to wait 50 years to get 50 stripes before they can climb the ladder. So that's about identifying talent super quickly and about identifying their skill set and what they want to be experts in. I think we're getting a lot of people come out of uni now, and there's some really great clinicians and there's some okay clinicians who are really great academics. Well, we need research to drive us forward. So why aren't we saying, okay, well, why don't we look at doing a different model for grads where you might do, these guys, this group, do a 2-year grad program that might have research combined in it, with view to eventually we know they're going to be more of a research nurse than they are an actual clinician on the floor, and, you know, sort of pave the way for that career progression for them.
Yeah, no, I think a lot resonates with myself with what you've just mentioned, and so many nurses, also internationally, with so many of those elements. And there's a lot of themes there that are absolutely powerful, and could actually be really beneficial to not only small teams in hospitals but to whole systems. So when you're wanting for that next step up, Amanda, and go into Parliament, I think it's calling you.
Yeah, we'll see, one step at a time. I'm trying to work out my workload now.
Yeah, exactly. I guess that on that element of leadership, because you're mentioning so many elements that I see fundamental to leaders, is to listening to staff, to be dynamic and adaptable, to support a workforce so they can perform what they do. Um, from a leadership perspective, sorry, do you pride yourself on any themes or any concepts, or is it a lead first on, these are the things that I believe in, I'm going to just demonstrate that? What when you're thinking about leadership, is there any particular themes, and have you always considered yourself a leader?
Oh gosh, so big questions. So for me, leadership is about walking the walk and talking the talk. It's about role modeling. Second to that, for me, my values are everything to me, whether I'm at work or I'm a mum or I'm in public. And so we talk a lot about, there's lots of, catch cries that go around in terms of integrity, loyalty, honesty, and they're all great. But for me, it's about being authentic. You have to be real. You have to be believable. You don't necessarily have to be liked, but you better know and respect people that you're working with. It's no different to, going through a Woolworths checkout and saying hello. That should be the expectation. And similarly, the standard you walk past is the standard you accept. So for me, it is about bringing your true self to work. It's obviously about leaving some of your home life at the door. You can't bring, there's a place for it, but it's about being real. My team know me, and they know me fairly well. They know snippets of my life and my story, and they know exactly why I think the way I think. And I've been very clear about that. I present in a new position, when I change positions, I always make sure that I do a snippet about who I am and how I've come to be where I am today, so that they can get an understanding of what matters to me, so they know how to communicate with me as well. So they've got an upper hand before they come in and expect that I might be a certain way that I might not necessarily be like. Second to that, in terms of leadership, look, Anthol, I didn't really know what an EDON was probably 7 years ago. It was a acronym. In some ways we used to say that they sat up there in the Tower of Power where I used to work, not to say that they were bad people or anything like that. We just didn't, you don't know what you don't know. I guess as a clinician, I probably led in terms of, I was extremely dynamic right from the get-go for nursing. I was very passionate about it. I wanted to learn about it, so I did. So, when somebody asked me to do something, you can guarantee that I had read everything I needed to know before I delivered that care and got that outcome. And I think a little bit that, from a nursing perspective, everyone's a leader. Even if you're an AIN, you're a leader. You're coming to work with the most vulnerable population who have a whole heap of things going on, and you're going to tell them or help them to do what they need to do to survive that minute in that day. And that takes leadership. Anything that you're trying to influence somebody else to do is a leadership skill. It's just about how you develop it and how you get to where you need to go. So look, yes, there's a little bit of me that probably is a little bit of a leader, but I'd like to think that, I'm a really good follower as well. Like, I find my people, I look to them, and I seek support when I need it.
Yeah, like I think the enrolled nurses and everyone who who fronts up to work would resonate with that, because when you're advocating for patients, that does take that leadership component. And there's certainly different types of leadership and levels, and but if you speak with heart and you speak with what's important to you, and really lead with that empathy for yourself and for the people you talk to or you're working with, it's a good place to start. And I really feel that passion that you just shared, because it bounced through, because I think it resonates with how you want to be. And so I think it's a great place to be as a leader, and as someone who shares probably the same sort of opinions as yourself in that leadership space. We've touched on some really powerful topics and some elements that would really resonate with people of LinkedIn. If someone wanted to reach out and just say hello, or just to touch base with you, is there can they do that via LinkedIn?
Yeah, absolutely, Anthel. I'm absolutely open to sharing whatever knowledge I have, and anything that I can or can't help you with, I generally know somebody awesome who probably can. I'm very happy for people to reach out. That's how you and I got started conversing, and the only thing I ask is that you pay it forward.
Absolutely. I love the pay it forward message and methodology. Totally. Well, thank you very much for joining me today, Amanda, and I look forward to chatting again soon.
Lovely. Thanks, Anthel. See you later.
See ya.